Good afternoon, everyone. I'm Bert Eichold, Health Officer of Mobile County. Today is with sad news that I report that we've lost our first patient in Mobile County to the coronavirus. We've had 587 cases in in Alabama, since this COVID-19 event has started. It's gone up from 524 over the past 24 hours to 587 in Alabama. Mobile currently has 23 cases. We had 19 cases yesterday. The virus continues to impact individuals, and we have sympathy for the loss of one beautiful person in our county. We hope that we can have efforts to contain the spread of this virus over the next period of time, and we completely support our healthcare industry in trying to prevent the spread of this virus and overloading our hospitals. So with that, I would like to turn it over to Dr. Murphree, but the time period I think is important is that the patient was admitted to the hospital on the 19th, was diagnosed on the 24th with a positive blood test, or swab, and then was deceased on the 27th. So the 19th to the 27th is the timeline from the time the person presented and got sick until there was a loss of life. Again, our sympathy goes out to the family, friends, and to everybody in our community. We're working as hard as we can to prevent the spread of this deadly virus.
Thank you, Dr. Eichold. So I will report on a couple other statistics that we've been trying to report out each day. So as you know, this is the first death in Mobile County that you just heard from Dr. Eichold. The state has reported 3 other cases that have passed away. You know, today is just 2 weeks since the day the first case was reported in Alabama. So on Friday the 13th, 2 weeks ago from today, Alabama reported its first case, and we have nearly 600 cases now statewide. So I just want to reflect and emphasize that so that we can just remind folks how important it is that you adhere to the advice of the public health practitioners and our governors and state health officer, and as we continue to follow guidance from the Centers for Disease Control and the Alabama Department of Public Health to try to mitigate what's going on in our community with regard to the spread of coronavirus. So the state also has posted that 4,755 total tests have been conducted. In Mobile County today, we have a cumulative number of 291 negative tests. So before I go into answering some questions that have been presented to us by some media and just our constituents, I want to invite up Jerry Carl, President of the County Commission and thus a member of the Mobile County Board of Health, who's going to make some remarks on the community prevention measures that you may have heard came down from the state health officer today.
Thank you. My name is Jerry Carl, Mobile County Commissioner, President, and I appreciate the opportunity to come and address this briefly. We did get from the governor, we got a list of closures that we're looking at. They will all be listed on this website. I'm sure you can also pull them up through the state. The biggest thing I want to assure people is we, the county, are doing as much as we can to fill in the gaps with security of the Sheriff's Department, with helping through the clinics themselves. But the biggest thing we can do, you're the one that can get it done. What that is stay at home. Proper hygiene. Keep your hands washed. Watch people coming in and out of your homes. Make sure they wash. And just proper hygiene and stay at home. We will beat this. We will beat this as a community. I promise you. We will see a spike. Everyone has predicted this for the last month. So we're spiking right now, but it will level off and it will start back down. But until then, one life is all we want to lose. We don't want another loss. So if you want to help us prevent that, stay at home. Proper hygiene, and follow these rules on the closures. Most of these are ancillary things to our lives, not to the business owners because it will impact them. but as far as ourselves, it's really an ancillary thing. But thank you, appreciate it.
Thank you. Thank you. Just to emphasize those remarks, we had someone write to us and say, you know, why does the Mobile County Health Department only advise those who are sick to stay home? And we are not advising only those that are sick to stay home. Maybe I've been unclear about this, but for some time now, we've been advising people to avoid mass gatherings of 25 people or more. And if you are in certain age categories, if you're over 65, or if you have comorbidities or other underlying health conditions, then we urge you to stay inside as much as possible. But with the state health officer's health order extending closures to many more facilities, again, we don't want you out and about in the community unless you absolutely have to get out. And if you are in those high-risk groups that we reviewed yesterday, please have someone else run your errands and try to stay home to the greatest extent possible. So I just wanted to, again, add to Mr. Carl's recommendation to please stay at home and follow the advice of your trusted healthcare community and hopefully your trusted health department. So someone also wrote in and mentioned that, brought to bear a comment I made yesterday that had been slightly misunderstood. There was a report on WKRG earlier today that implied that the Mobile County Health Department would not be releasing information on the number of COVID patients hospitalized in Mobile County, and that is not true. What I said yesterday was that we will not be releasing the number of hospital beds that are available, staffed, or filled in Mobile County. So that's different. We do not release, we know the information on how many beds are available, how many ICU beds, how many ventilators, but that's not something that we share with the public. We will be sharing information on the number of people hospitalized with COVID-19 in Mobile County once our number of cases reaches 50. So when we have 50 cases, we think that will be enough that we will be able to release aggregate information on those cases, like the percent that are hospitalized, the age range, the mean and median age, potentially, well, you know, their sex, ethnicity, those sorts of things. And we probably will not be able to release geographic location below a zip code until we have at least 5 cases, or at least 5 cases in an individual zip code. We know that there is an appetite for information. We just want to make sure we get it right without violating the Health Insurance Portability and Accountability Act by releasing individual information or information that could potentially identify inadvertently the identity of someone who has a case of COVID-19. So again, we will release that information in aggregate once we have at least 50 cases. So let's see, a couple other questions that I've not gotten around to asking the last couple of days. One is, are people with type A blood more susceptible to COVID-19, and are type O less susceptible? So this rumor, this social media information that's been flying around stems from a study of patients in China. I believe it was an unpublished study, but it was a limited number of study participants. And as we are learning with this new coronavirus, we learn more and more as time goes by, and we will continue to learn more. So additional research is really needed to corroborate these preliminary findings. So in no way should we use blood type as a guide to make clinical practice decisions or to recommend or restrict behaviors of the general population. So regardless of your blood type, everyone's encouraged to abide by the CDC, ADPH, and Mchd guidelines for community mitigation, social distancing, covering your cough, protecting yourself, washing your hands, those types of things. Another question we got came from a New York Times article that suggested that Mardi Gras may be to blame for the outbreak in New Orleans and throughout Louisiana. And, you know, while social gatherings of any kind like Mardi Gras could potentially increase the likelihood of any contagious disease such as flu or common cold and coronavirus, right now there's really no scientific evidence that this is what's happened in in New Orleans. I think the concern is that they're a port city and have Mardi Gras, we're a port city and have Mardi Gras. I've looked at our preliminary data of the cases in Mobile County, and since that Tuesday was on the 25th of February, from that date to 2 weeks takes us to early March. And our first cases did not begin symptom onset until 5 or 6 days outside of that 14-day incubation period. So we don't have any evidence right now to suggest that we had a high level of transmission going on during Mardi Gras in Mobile. So let's see, what else do I have here that I need to talk about? So just to recap on the state health officer, the health order today. So the list of businesses, venues, and activities closed to non-employees or will not take place: entertainment venues, athletic facilities and activities, close contact service providers like barbershops, hair salons, and other types of salons, and retail stores like furniture stores, clothing accessories, jewelry, luggage, department stores, sporting goods, book, craft, and music. One thing about the department store closing: if you are a department store that also serves groceries or sells groceries, you do not have to close the department store, the other regular goods part of your grocery store. At least that's what we're being told today, but stay tuned for some more information on that. Mark, are there any questions online that you want me to answer?
What is the comorbidity? But I believe it was answered. What is comorbidity?
Oh, sorry. Comorbidity means that you have a condition that sort of predisposes you to get sick more easily than other folks. So if you have diabetes, hypertension, if you are immunocompromised or having cancer treatment, if you're obese, of any age, if you're obese, if you're over 65, those sorts of things, it means you have, health conditions that make it especially difficult for you to fight off an infection like COVID-19. Is that it? Okay. So before we leave today, Amanda Arnold is going to come back and remind us about some of the changes that are coming to the WIC program on Monday.
Thanks, Rendi. Just a real quick recap, taking measures recommended by our public health community. The WIC program is making some major changes to how we run our business. As of starting Monday, March 30th, all WIC clinics will be allowed to complete their appointments over the telephone. So we're asking that anybody who has a scheduled appointment to please call their clinic at their scheduled time, and our staff will talk you through your appointment. To expedite this process, we're also allowing that all the proofs that are required, your proof of residency, proof of ID, proof of income, can all be emailed to us prior to your appointment, and we can have all that in the computer ready to go. That email address is wicmchd@mchd.org. That's wicmchd@mchd.org. So if y'all could start sending those in, we're sending them to the right clinic and making sure they're getting where they need to be and getting them in our system. You can expect this to be a little bit of a longer appointment just because we're doing it over the phone. So please be patient with us, and when you call in, be available for the next 45 minutes to an hour to make sure that happens. So just be patient, because this Monday is the first day we're doing this, but we're trying to keep everybody at home like we've been told and asked to do. The next thing, this is new. So if you are scheduled for a pickup, you're just coming in, or you're just scheduled to pick up and get your card loaded, that will now be done remotely, and you don't even have to come in or call. It's going to be done the day before your due date. So the state's going to load your card for you. You don't have to do that anymore. This includes any family that does not have somebody with a clinic issued formula. If you have a clinic issued formula and you come every month to get your formula from us, you will continue to have to do that, as will, and we'll also we'll give you your formula, and you will get your benefits for everybody else in your family at the same time. That will be taking place at the Teen Center WIC Clinic at 248 Cox Street. That's across from Children's and Women's and down the street from the Strata Clinic. It's between the hours of 7:30 and 4 p.m. Monday through Friday. Somebody from the WIC department will be there to give you your formula. If you have any questions, please give us a call at 251-694-3942. And if you don't get us on the phone, just leave us a message, and I promise we'll get back to you as fast as we can. We're working as fast as we can, but just email those proofs into us. Don't forget your appointments, but please, please, please heed the advice and stay home. Thanks, guys.
Thank you, Amanda. Okay, Mark, did you say you had another question
Why
queued?
didn't preschool and daycares receive more official mandates like the public and private school sectors?
So they have, one of the things that's important with keeping preschools and daycares open is that we need to keep our first responders, our healthcare providers, our hospital employees, we need to keep them at work. And the only way that they can do that is if they have health care, if they have children. So that's an important piece of being able to provide some, some availability to child and daycare so that we can keep their first responders. We need grocery workers being able to get to groceries. We need other essential services to stay open, and those folks need child care in order to do that. Anything else, Mark?
We want to mention other times, changes.
Yep, about to do that. Okay, thank you. All right, so just want to let you know that the Mobile County Health Department information line, prescription line, and medical triage line will be closed on Saturday and Sunday, but you can get information directly from the Alabama Department of Public Health 7 days a week from 7 a.m. to 9 p.m. by calling 800-270-7268. Or you can email them at covid19info@adph.state.al.us. And if you want to call to get some information on testing locations in Mobile County, you can call ADPH at 888-264-2256. Starting next week, there are some changes in other Mobile County Health Department services. OB services will be offered at the Women's Health Clinic directly behind the Newbern Center, Mondays and Thursdays, 7:30 to 4:30. And urgent care at our Keeler building downtown, again, will be open Monday through Friday, 7:30 to 4:30 at 251 North Bayou Street. You definitely need to call ahead to make sure that we can get you in. Only sick patients are allowed to come to the Keeler location for urgent care. So with that,
One more.
okay, Mark.
Can you test for COVID-19 with a blood test besides the other?
Okay, so this is going to be a little tricky. So remember a couple of days ago, we talked about the testing materials that you need for the PCR test that tests for the live virus. And it's this nifty swab that's got a little bristle on the end of it. And so it's a nasopharyngeal swab. So it has to go into your nose and then back far enough so that they can get a sample from your nasopharynx. And then it goes into the sample vial, it bends here. And this is what goes to the state lab or to the commercial laboratory for PCR testing for the COVID virus. The blood test is a test that looks for antibodies that your body may have begun developing or producing in response to your immune system seeing that virus. So this is for live virus that says that you right now have live virus circulating in your respiratory system, right? The antibody test or the blood test detects antibodies that are circulating in your blood that are produced by your immune system in response to that infection. It does not necessarily indicate, and usually it is only positive sometime after you have active disease and are shedding virus. So virus test, active disease, you're shedding virus. The blood test, you have been infected sometime prior and you have the antibodies still lingering in your blood. So with that, I will say, again, remember, we went from 1 to almost 600 cases in 2 weeks. It's very important that you stay at home if you can, and that if you're sick, you isolate yourself from others from getting them sick. So our live updates will continue on Monday at 2:30 unless we're told otherwise. So have a great weekend, and we'll talk to you next week.